Hello everyone and welcome to Know Your Drug, the ultimate destination for all things of health and wellness from the fascinating world of pharmaceutical. We are here to guide you on Citicoline Tablet, exploring the various aspects of Citicoline, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Citicoline Tablet. Citicoline is a medication that is used to treat various neurological disorders and cognitive impairments. Here are some common uses of Citicoline tablets. In case of stroke recovery, Citicoline is often prescribed to individuals who have experienced a stroke. It helps in the recovery process by improving blood flow to the brain, protecting brain cells from damage, and promoting the repair of damaged nerve tissues. In case of cognitive disorders, Citicoline is used in the treatment of various cognitive disorders, such as mild cognitive impairment, dementia, and Alzheimer's disease. It may help improve memory, attention, and overall cognitive function. In case of traumatic brain injury, Citicoline has been studied for its potential benefits in patients with traumatic brain injuries, TBI. It may aid in reducing brain damage and promoting neurological recovery after a traumatic injury to the head. For age-related cognitive decline, as people age, they may experience a decline in cognitive function. Citicoline is sometimes used as a supplement to support brain health and potentially slow down cognitive decline in elderly individuals. In case of glaucoma, some studies suggest that Citicoline may have a protective effect on the optic nerve and could be used as an adjunct treatment for glaucoma, a condition characterized by increased pressure in the eye that can lead to vision loss. Dosage of Citicoline tablet. The dosage of Citicoline tablets can vary depending on the specific medical condition being treated, the severity of the condition, the patient's age, weight, and overall health. The information below is a general guideline and should not be used as a substitute for professional medical advice. For stroke recovery and cognitive disorders, the typical recommended dosage of Citicoline is usually between 500 mg to 2,000 mg per day, divided into 2 or more doses. In some cases, higher doses of up to 4,000 mg per day may be prescribed for acute treatment. For age-related cognitive decline, the usual dosage is often around 1,000 mg per day, divided into 2 doses. For traumatic brain injury and glaucoma, the dosage can vary widely depending on the severity of the condition and the physician's judgment. Typically, higher doses might be prescribed for these conditions, but it should always be determined by a healthcare professional. It is essential to take Citicoline tablets as prescribed, and if you miss a dose, do not double the next dose. Mechanism of action of Citicoline tablet. Citicoline, also known as cytidine diphosphate choline, is a compound that plays a crucial role in the synthesis of cell membrane phospholipids, particularly phosphatidylcholine. It is a naturally occurring compound in the body and can also be obtained from dietary sources. The mechanism of action of Citicoline involves several processes that contribute to its beneficial effects on the brain and nervous system. Phospholipid precursor. Citicoline serves as a precursor for the synthesis of phospholipids, including phosphatidylcholine, which is a vital component of cell membranes in the brain and other neural tissues. Phospholipids play a crucial role in maintaining the structural integrity and fluidity of cell membranes. Neurotransmitter regulation. Citicoline influences the levels of certain neurotransmitters in the brain, including acetylcholine, dopamine, and norepinephrine. Acetylcholine is involved in memory, learning, and cognitive function, while dopamine and norepinephrine are associated with mood regulation and focus. Increased blood flow. Citicoline has been shown to improve cerebral blood flow, enhancing the delivery of oxygen and nutrients to brain cells. This increased blood flow can help support brain function and protect against ischemic damage, which occurs when the brain doesn't receive enough blood flow. Neuroprotection. Citicoline has demonstrated neuroprotective properties, which means it helps protect brain cells from damage caused by various factors, including oxidative stress, inflammation, and certain neurotoxic substances. This neuroprotection is particularly relevant in conditions like stroke and traumatic brain injury. Enhanced brain energy metabolism. Citicoline is involved in the regulation of brain energy metabolism. It can increase the production of adenosine triphosphate, which is the primary energy currency of cells, providing energy to support various cellular processes in the brain. Repair and regeneration. Citicoline may promote nerve cell repair and regeneration, potentially aiding in the recovery process after brain injuries or neurological damage. Due to these mechanisms of action, citicoline is used in the treatment of various neurological disorders, cognitive impairments, and age-related cognitive decline. However, it's important to note that while citicoline has shown promise in clinical studies, individual responses to the medication can vary, and its effectiveness may depend on the specific condition being treated and other individual factors. As with any medication, its use should always be under the guidance of a healthcare professional. Side effects of Citicoline tablet. Citicoline is generally considered safe and well tolerated when used at recommended dosages. However, like any medication, it can potentially cause side effects in some individuals. Common side effects may include gastrointestinal disturbances, headache, insomnia or sleep disturbances, dizziness or vertigo, hypotension, allergic reactions. It's important to remember that not everyone will experience these side effects, and many people tolerate citicoline well. Important advices for using Citicoline tablet. When using Citicoline tablets, it's essential to follow some important advice to ensure safe and effective use. Here are some guidelines to consider. Always use Citicoline under the guidance and prescription of a qualified healthcare professional. Follow the prescribed dosage and dosing schedule exactly as instructed by your doctor. Avoid taking more than the recommended amount or altering the dosing frequency without medical approval. Citicoline tablets are generally taken with food to enhance absorption and minimize the risk of gastrointestinal side effects. Follow your doctor's instructions regarding the best time to take the medication. Be vigilant for any potential side effects while taking Citicoline. If you experience any unusual symptoms or allergic reactions, such as skin rashes, swelling, or difficulty breathing, stop using the medication and seek immediate medical attention. Inform your healthcare provider about any other medications, supplements, or herbal products you are taking before starting Citicoline. Some drugs may interact with Citicoline, affecting its effectiveness or increasing the risk of side effects. If you are pregnant, planning to become pregnant, or breastfeeding, consult your doctor before using Citicoline. If you have a history of certain medical conditions, such as hypotension, low blood pressure, epilepsy, or Parkinson's disease, use Citicoline with caution and inform your doctor before starting treatment. Avoid excessive alcohol consumption while using Citicoline, as alcohol may interfere with its beneficial effects on brain function. Citicoline's effectiveness may take time to be noticeable. Consistent use as prescribed by your doctor is essential to experience potential benefits. Store Citicoline tablets in a cool, dry place away from direct sunlight and out of reach of children. Remember, Citicoline is not a substitute for a balanced diet or healthy lifestyle. It is essential to maintain overall well-being by engaging in regular physical activity, eating a nutritious diet, managing stress, and getting sufficient sleep. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking Citicoline tablet. Remember, knowledge is power, and being well-informed empowers you to make the best decisions for your